we end up the first part of the day by just a short conclusion, so to say. And you brought up the problem with security, but I think one of the political things we have to be very much more focused on is the benefit for the user, as you also mentioned. So I'll do this presentation with Anders Erlandsson sitting there and Tobias Sonne, and they will just present a few user-driven investments they have done and solutions. But I think the central thing here is to say, well, the question of the day here is how do we get the best use of our potential? That goes for every person that, as you said, have different background, their different genetic makeup. They may have different area levels where they get stressed and get their sweet spot where it's getting productive and not chronic. And also the social thing, sharing thing with other people, developing yourself in a social context, as I understand, is three of the main points of what you said. And this goes for the person, but also, of course, for the country here. This is a world map with Denmark as a small spot up there. But how do we kind of get the best out of what we have in Denmark for ourselves and for the world? So, I mean, for Denmark, it's logical. You have to think about how you can kind of interact with the world, as we're doing today with the UK, but also for the person in this version 3.0 I talked about, maybe 4.0 should be the right thing to do it, but the community aspect is important and the sharing of knowledge. So what do we have in Denmark? I mean, we have been talking a lot about what we have in England, and maybe not all of you know what are the potentials from a data point of view in Denmark. The most important thing, the strongest thing when we compare UK and Denmark is we have this personal ID, who actually overcome some of the problems that you have following people when they change doctors, so things like that. We also have big biobanks because we have routine taking blood samples from the heel of small children getting born. And then we have the registers that we talked about and the birth cohorts. Down here you have, this is what we all have in our pocket here. It's a registration with our personal ID number. But it's all about relations, so to say. The most simple kind of relation is actually the genetic one can say. Say, well, you have parents, you have grandparents, and you are related to these persons on a biological way, that you share genes, and the further away you get in relation, of course, you have less to share. But this is the simple part. But in fact, we have a project here in Denmark, which is it's very close to the Iceland gene mapping of the whole population. But here we have a certain focus on mental health. And it's my good colleague Anders Børlum and his colleagues who have got this funding from the Lundbeck Foundation. I think it's about $250 million. They have gotten Danish crowns, not in euro. But what they're doing is they GVAS 5.5 thousand with schizophrenia, 20,000 with affective disorders, and 16,000 with autism or autism spectrum disorders, and 18,000 with ADHD, and then they have 25,000 controls. And they GVAS all of these people. This is, of course, an opportunity, because thinking about how you can connect these data with the register data we have, and even maybe what you'll describe, the tracking, because what you will see later that Tobias will present something about ADHD apps, and you will present an Asperger app. So think about how you can compare this, and maybe if we talk about individualized medicine, it's a more low-hanging fruit to focus on how to machine learn and get a user perspective and individualize your treatment by having kind of the interaction with the person. This, I think, is to this point not very precise. You might correct me, Mike, if you disagree, but you're not really, I mean, there's so much happening after just a simple gene. The GVAS just describes the potential, as you say, but all the reading of the things, all the environmental interaction is not really included here. But we have, as we have done together, use the public registers. When it gets more complicated, we actually involve environment. Then the relation gets more complicated, but still very important. In Denmark and Sweden and Finland, we have combined a number of cohorts. So we have I think the largest cohort I ever heard about in science, at least more than 7 million children we can follow from before birth and onwards. And this makes a possibility for studying very seldom disorders, and also for having sibling match designs that we have tried to kind of rule out if one child is exposed and another is not exposed. We're more likely to be get information about was it the exposure or was it the family relation. But also in the birth cohorts, at least in Denmark, we are trying out now a project where we kind of think of the epigenetics of these disorders, where we have actually a little bit of blood, and we have a little bit more blood than in the national registers. So we're able to do this. But I think the most important thing, and what Robert is actually referring to, is this project that we're doing with Danish municipalities. We have something called Sundhed.dk, it's down here. And this is interesting because there's a very direct interaction with the municipalities, with the professionals, and with the users, the children. So this is a new opportunity. We call it interactive epidemiology, but combining these opportunities, I think it really is a strong case in science. The next thing is, how do we learn from these relations? I mean, just today, learning from what you have in the UK, and maybe you said this, I like this expression of your, Lars, it's not big brother, it's big mother. I have to think about what you mean by that. Why is it not big father? But this interaction between relations is kind of very important when it comes to interventions that we could think about and we have to discuss later today. And going back to this from the mental capital, I can highly recommend you to study this, because you see everything we talked about with stress here, the featured programming, all the things that we think is important in understanding how what causes mental health, and also to be inspired for interventions. I think I was, for my part, very inspired by this English large work. I think it was 800 scientists and stakeholders taken in by the UK government to kind of support the political decisions by knowledge. And I like very much this tradition to spill over to the Danish way we do it, because I think we haven't got the same kind of organization getting support from the knowledge environment as you have in the UK, where you have a scientific advisor for each ministry. So growing up in Denmark, I mean, if you take the person here, and we have the heart here, we have many good hearts, we have kind of communication here, being able to share your feelings, share your experiences, as has been mentioned today. You have down here is educational service, maybe the school and all the medical system. The guy up here should be the psychiatrist. And down here you have the family and the social workers working with the family. Everything is linked in Denmark, all these services, because if you get a public service, it's registered. It makes sense because we have to keep track on economy, but it also makes a number of possibilities of following people from a health and welfare perspective. The challenge now, I think, and you mentioned one of them with the security, is how do we make everybody feel confident about all this? I mean, everyone in here would be likely to be more confident than the mean population, not the mean population, but the rest of the population. And I think, why would you share your data? I mean, putting this question to American citizens, say, well, this is my data. I pay for the health services, so this is my data. But in fact, here we have some kind of collective culture saying, well, maybe we get the best support and treatment by kind of letting our treatment inspire the next treatment and gaining knowledge from this. This is kind of logical. Of course, this should be balanced about in contrast to autonomy, but I think what you can do with cryptation might be the solution, moving us from up here. So if you have the security, and you can say, well, this will be deleted in maybe 5 minutes. I mean, you might have doing this kind of things, but and we know that's you, but in 5 minutes it's just deleted, so we only have the basic information. All this kind of innovative way of handling data is important. So, but I think this down here is the most important. And this is the reason why we decided to end up this morning here with a specific presentation of 2 cases where the users has been invited very early. And I think we're moving in direction for the version 3.0 or 4.0, that we get the user much more in the center of what we're doing. And I think this is a really nice development. So we learn from each other and much more close interaction between professionals and the users.